Hello, my name is Brian Gomez, and today I'll be demonstrating NG irrigation. So first thing, let's check the doctor's orders, make sure that this is the right patient in the right order, and it is. So I'm going to go ahead and enter the room. I'm going to go ahead and wash my hands. I'm also going to then don my gloves. I'm also going to introduce myself to my patient and also identify my patient. I'll say, hi, my name is Brian, I'm your nurse today. And ask for your first name, last name, and your date of birth. And once the patient confirms that information, I'll also check his wristband just to make sure. Okay, thank you, Mr. Smith. So just so you know, I'm going to be working with you, and I'm going to check your NG to make sure it's going okay. Okay, any questions at the moment? No? Okay, so then I'm going to go ahead and close the room. I'll provide for privacy, so I'm going to close that as well. I have my equipment partial set up here, so I'm going to go ahead and finish setting that up. I have the doctor's order asked for saline solution, so I have that there. So I have a container to put the saline solution in. I'm also, when we're doing the aspirating, we're going to testing the airway. It's actually 20 cc's, so I'm going to prep the 20 cc's now of air. I'm also going to pour in that 20 cc's of saline solution that we're going to be using. That's 20. Just a little bit closer to me. So I'm going to go ahead and I'm going to raise the clamp to my working height. This time also turn off suction. Just drop. And also raise them at 30 degrees. We'll do okay, Mr. Smith? Okay, good. At this point, I'm going to go ahead and make sure also that the tape and the line is secure in the nose. Make sure there's no obstructions or is dislodged or anything. I also want to make sure that the NG tube is in the right spot, so I'm actually going to go ahead and try to listen for that. So I'm going to go ahead and disconnect suction. And real quickly, I'm going to use a piece of gauze or something clean to go ahead and put that tip in here. Tuck that in here just to keep that from flaring around. I already have the 20 cc's prepped of air here. So I'll go ahead and attach that in here. And I'm going to go ahead and now this part we're going to find the xiphoid process and go just to the left of that. So I'll go ahead and use my stethoscope, and when I push the 20 cc's of air in, I should be able to hear kind of a whooshing sound to make sure that and to ensure that the tube is in the right spot. So xiphoid process. Just to the left, and with 20 cc's of air, I'm going to go ahead and push that in. Okay, I heard that. So the tube is in the right spot. If I was concerned and I thought it wasn't in the correct spot, I would then order an x-ray and make sure that was in the correct spot. Or if the doctor ordered for us to test the stomach acid, we would then pull out 20 cc's and then go ahead and have that tested or send it out for tests. But in this case, we're not doing that, so I'm going to go ahead and irrigate or flush the tube. So I'm going to remove the tube syringe. I'm going to then take the 20 cc's of the saline solution. Go ahead and upright position, insert the 20 cc's. And then I'm going to now pull out 20 cc's again. That way you can assess the fluids. So I'm going to go ahead and just put this in my irrigation tray. I'm going to go ahead and see the color, consistency, if there's any odor. If everything is looking okay, then that's a good sign. So I'm going to go ahead and make sure that the client is comfortable. So for safety, I'm just going to put this up. I'm going to slow arm this a little bit. Doing okay still, Mr. Smith? Yep. Okay. So I'm going to lower this to low setting for safety purposes again. And I'm also going to reconnect suction and turn suction on as well. So adjust the sheet, the drapes and sheets to make sure that you're still comfortable. Suction's on. All my equipment over here. So now I'll go ahead and wash my equipment and make sure that everything is clean. Wash everything appropriately. And also label it with a date, time, and my initials, just because then this can only be used within 24 hours of opening. So that's going to be used, and I'm going to store that for access for either the next nurse or myself next time. I'm going to go ahead and put the call button also before I leave, so I want to make sure the client can find me if he needs anything. I'm going to remove my gloves. I'm going to wash my hands, and then I'm going to go ahead and document input and output and anything else that was important during my session with Mr. Smith. And that is how you NG irrigation.